We're going to talk a little bit today about MyHealthELink and how we use it in our practice.
What HealthELink allows the patient to do is to go into their computer on their timeline when it's convenient for them and ask us questions or schedule appointments or request refills or just request follow-up information from the providers in the practice.
When we started this many years ago, I was a little uncomfortable thinking I would get inundated with messages, and that's really not the case. The message comes into a centralized person in the office, and then they disperse to whoever should receive and act upon the information. If a patient's asking for a refill, that would go to the clinical staff. If there's a question about a referral, that goes to our referral coordinator.
When patients have lab studies, we need to inform the patient of those results. In the past, that meant several phone calls to the patients to try to relay this information. Now with HealthELink, it's sent to them automatically, so it doesn't even require us to make a phone call. If we want to make comments about the labs or give them instructions about follow-up, we're also able to do that right there, and the patient can read that online. So it takes a lot of the phone call returns and phone tag away from our office practice and frees up our medical staff to take care of the patients that are in the office needing care in front of them at the moment.
MyHealthELink is very easy to work with. I think it's easy for patients, it's easy for staff. It's basically point and click. If you can work with the computer at all with email, you can handle this program with no difficulty.
MyHealthELink is free of charge for all of our patients and all of our doctors' offices. I find it very user-friendly, and a lot of patients have as well. Older patients like to see the actual website first and then go home, and then they know what they're looking at when they get home. But the younger, more technology-savvy people will be able to just take their username and go home and look at it for the first time there.
In our office, we really try to encourage people to sign up for MyHealthELink. That starts when they come in the door and register. The front office makes sure that we have their email address, and we're actually signing people up right in the office now at checkout. I probably use it most to relay test results to patients. I like it because they see the actual numbers, they see exactly what I'm trying to relay to them. If a prescription refill comes in and I refill that, there's a little box you check and the patient gets a message that it's been taken care of.
From a provider standpoint, it requires essentially no effort to have patients sign up for HealthELink. It's done by your staff. It's a very simple process for them. It's much more efficient. Everything's recorded, it's documented, it's in the note. Even if you talk to a patient on the phone and give them the same information, you still have to document that information in the note. This takes care of that for you. It kills two birds with one stone.
Thank you for taking the time to look into MyHealthELink.
Remember, you can enroll anywhere, easy and free. Go to riversideonline.com now for more information.